introducing our session today, which is the impacts of hospitalization on students' academics and development and the need for teachers in the hospital setting. Children who are hospitalized with chronic conditions lose their opportunity to learn in a traditional classroom setting. Hospitalized children have increased odds of performing below the national minimum standard, BNMS, across all domains at each school grade. Educational support and teachers are vital in improving these children's academic outcomes. And this presentation examines the needs and benefits of teachers in the hospital setting to improve academic outcomes. There's a lot of intersectionality around teachers in a hospital setting and social services, social work, and our presenter today, DeJuanet Sanford, she is a child life specialist, and child life specialists are integral to bridging the gap between the teaching setting in the hospital setting with teachers and creating a fulfilling experience for learning even when students are hospitalized. And I have to say, as personal experience with my son, who was in a hospital setting on and off for a lot during his early years, child life specialists are integral to their student development and children development at all stages in life. So they work with early childhood ed all the way through into the high school setting and potentially even beyond. And they are amazing advocates for students and getting their proper support and education in the hospital setting. So with that, I am going to turn this over to Ms. Sanford, and let's give her a great Zoom welcome and thumbs up and applause for Ms. Sanford.
Thank you so much. And I will wait until you share the screens. Again, my name is DeJuanet Sanford. I am a certified child life specialist. I currently am working at Children's Hospital of Los Angeles in the bone marrow transplant unit. Do want to highlight that I am going to be speaking from the perspective of a specialist. So although I'll be covering the needs and how I even collaborate with teachers inside of the hospital, just want to make sure that I do highlight the fact that I am speaking from the perspective of an actual child life specialist. So again, thank you for joining. And again, my presentation is going to be on the impacts of hospitalization on children's development and academic and the need for teachers in a hospital setting.
Are you ready for the next slide?
Yes, please. All right, so some of our objectives, we are going to examine the role of a child life specialist. Some of you may be familiar, but if this is your first introduction, I will be speaking on it high level. I do know there's another session at 6 o'clock with Misty Lindquist, who she does dive in a little bit more deeper into the role of a child life specialist and how it relates to like more than play. So please join her session if you do want to look or get more of an insight on what we do in the hospital. Next, we'll be reviewing the impacts of hospitalization on children's development and academics. And then lastly, we will explore some of the needs and benefits of our educational support for teachers in a hospital setting. Next. So what is a child life specialist? So child life specialists are educated and clinically trained in the developmental impacts of illness and injury. Their role helps to improve patient and family satisfaction and overall experience. Our training in development is not only how children develop from infancy all the way into early adulthood, but really we're trained in how the hospitalization for chronic and acute, which we'll get to, but really how hospitalized kids are impacted, how their development is impacted, how we see some regression of behaviors. And then our role again helps to improve patient and family satisfaction and just overall experience. Next. So we provide evidence-based, developmentally and psychologically appropriate interventions. This includes therapeutic play. So children who are hospitalized don't have the opportunity to play much. So we bring that play to them in a hospital. It can either be at bedside or it can be in a playroom. Not every hospital has playrooms, but at Children's Hospital of LA and most big hospitals that are children hospitals do have playrooms. So we definitely provide opportunities for children to still engage in play, which is so important for development. We help to prep them for any procedures or anything that they're going to be experiencing in the hospital. So a procedure can be like an IV, it can be an MRI, it can be an X-ray. The idea is just like any one of us, even as adults, anticipatory stress can be very overwhelming and could really impact how they experience these procedures. So by us prepping them ahead of time, hopefully our goal is to kind of reduce that anxiety and anticipatory stress. We also provide procedure support. So we are there with them while they're getting their IV starts, MRIs, X-rays, surgery, anything that they're going to experience, any procedure, whether at bedside or inside of an actual treatment room. We will be there helping them, reminding them of their coping skills, creating the plan within our preparation, but also being with them while they're actually in the procedure. We also play a vital role in grief and bereavement support. So when we have children or families that are at end of life, so even if it's an adult mom or adult dad or caregiver, grandma, family member, and there's children involved, we help navigate that grief and bereavement. We help explain it in a way that children understand that is developmentally appropriate. As well as being there in that moment when they're coming in, seeing their loved one that may have already died or is currently end of life and will die, have an anticipated death. Our education, again, aims to reduce fear, anxiety, and pain. Next. So now we'll look at chronically ill and then acutely ill before we jump into some of the impacts, just so we can understand what we're talking about when we talk about chronically ill children.
Oh, sorry.
It's okay. Plessy Pinkerton describes chronically ill children as a condition that lasts at least 3 months during the year, has intermittent impacts on daily functioning, may require in-home health services or frequent hospitalizations, and limits age-appropriate play, school performance, and education activities. So when you think about chronically ill, it's things that a child may have to deal with for a very long time. Anything 3 months on will be what we consider chronically ill. So children who may, like for me, I'm on the bone marrow transplant unit. So these are kids who are cancer patient. It can be HEMOC, oncology, so either blood or like tumors, things like that, things that may not, that we may not be able to cure right away or even at all. So we can only imagine how many times they're going to be hospitalized and have to miss school. So when we think about the chronically ill population, these are the children that we're referencing. Next. So looking at acute illness. So acute illnesses generally develops suddenly and last a short time, often only a few days or weeks. Acute illness may result in hospitalization, limiting also age-appropriate play, school performance, or education activities. So acute can be it can be anywhere from like the flu. It can be just anything that won't last too long. It can even be like a broken leg that we anticipate will heal after a while. It can be outpatient, like an outpatient procedure. Even if a child, so even though it's an acute illness, it may have a short impact. That still can have impacts to how they perform in school. It can also have impacts, even if it's something that was sudden that happened, it may have a long-term effect. So in this case, we still want to make sure that we're being inclusive with even the need for children that are experiencing acute illnesses as well. Next. So just a little statistics to kind of bring it all together. Approximately 6 million children from newborn to 17 are hospitalized for various of conditions in the United States each year. So I can only imagine as growing teachers and or students pursuing to be teachers, you may have kids that are in and out of the hospital. Although it may seem like even in a traditional classroom setting, you may not need a lot of the information with how it impacts children, hospitalization impacts children, but it is so important to know because just even the awareness that kids do deal with a lot of things outside of a classroom setting, it's important to understand how even being hospitalized for 3 days can impact a student when they come back into your classroom. So it really is important to just like realize how many of our children in the United States are impacted by hospitalization. Next. All right, so now we're going to look at the impacts of hospitalization on children's development. So first, a beautiful quote that I absolutely love and stand by is that all children are entitled to develop to their full potential through the benefits of healthcare and education. So as we navigate the rest of these slides, just want to keep that in mind that every child is entitled to develop, and we play such a vital role on helping them continue to meet their milestones, whether in healthcare or in education. All right, so child development. I won't get too much in details, just wanted to highlight some of when we talk about development, as we continue to talk about development, these are the things that are in the forefront of my mind. So language, right? Language is a huge development milestone that children should start to do even as early as infancy. Not really having the ability to play with other children and develop some of that language skills, or even have the opportunity to socialize with children of their age or even adults. You may see children in the hospital that family don't come visit them, and they don't really have that opportunity to develop their language. Literacy as well, not having the opportunity. A lot of kids who have been hospitalized and miss a lot of school, don't really, reading isn't fun to them, doing schoolwork isn't fun to them. So we play a vital role at kind of bridging that gap and figuring out how we can support them inside of the hospital. Social emotional as well. We know children that play with other children really start to develop that social emotional skill, although can be learned from adults. Playing with children their own age and having that opportunity to grow amongst children their own age is very vital for healthy development. Physical well-being, also important for development. Some of the impacts on hospitalization with that, whether in the hospital or even at home, some conditions make you not even really be able to physically get out of bed, play in sports like we see a lot of school age students do, play outside, things like that. So in a hospital, for children, for one, not feeling too well, right? Not really wanting to get out of bed, that may be impacted, but also not having the ability to go and run around at a playground. We do have physical therapy that we consult with all children who are candidates, meaning that they have limited ability to get out of bed. And physical therapy will come and do about a 30-minute to 45-minute session in the hospital. But still, children who are hospitalized aren't able to really get that physical movement inside of the hospital. Approaches to learning, obviously, every child learns differently. Some of the hospitalized kids is so important. Even for me, the first thing that we do as child life specialists is going inside of a room and assessing. So assessing what they already understand, assessing their development, assessing how and what ways they learn, so that I know how to implement effective interventions. So if I have a 5-year-old kid who may be developmentally 3 and learns from pictures, I'm going to more approach me prepping them from a procedure using pictures versus using language and things like that. Creative arts, same thing. A lot of inside of a school setting, there may be a lot of things that kind of promote creativeness, whereas in a hospital, we do have like art therapy, music therapy, which is awesome and great for the hospitals that do have that. But really being hospitalized does take an impact on having those isolated moments that they would traditionally have inside of a school settings to be creative and think creative. Science and mathematics the same type of way. So yeah, those are some like developmental domains and milestones that we see that are impacted severely when a child is frequently hospitalized. Next. So children's development impact their behavior in the way they think and mature. This is why I wanted to make sure that we brought in development before, because the way that they develop, where they are developmentally really has an impact on their behavior. It has an impact on the way they think, the way they perceive threats, right? The way they mature, the way they even post-hospitalization. So we really want to make sure that we're supporting their development inside of the hospital. Hospitalization, acute and chronic, may affect the process of proper child development, something that we've already kind of talked about. We can go to the next slide. Right. So the effects of hospitalization on school-age children, we're still looking from the perspective of development. So this is not limited to 5. I just brought out the 5 that I see often, that is that I have seen to be more prevalent. So 1 is going to be the loss of control and autonomy and competency. So children who are hospitalized, school-age specifically, we're talking about the loss of control and autonomy. A lot of children who are school age is really getting their sense of self. They're really learning how to like navigate relationships, how to be independent, how to be structured. Not being in a hospital doesn't really allow them to have a lot of that control and autonomy. A lot of times they have to take medication when it's scheduled. They have to wake up when it's scheduled. There's a lot of loss of that, which can have major impacts to a child's development. So if you do see them inside of a hospital setting or you do see them inside of a hospital or in a traditional classroom setting, you may see where they may be a little bit behind with being able to take more control or take more initiative originally, right? These are things that we can build back up, but just having the awareness that it is something that may be impacted if you see a child come inside of your classroom that has been hospitalized. Secondly, the loss of contact with their peer group that may result in feelings of anger, frustration, resentment, sadness, feeling left out. Any one of us, I know we're talking about school age children, but any one of us will feel these very things if we're hospitalized often or for a long period of time. So just the awareness of it so that we know how we can best support is so important. The lack of emotional support when separated from peers, that can be huge. We know that children, especially when they get school age, right? Their friends become so important. We do see that more in adolescence as well. By one of our famous theorists, Erickson, we do see a lot where like peers become more of an influence in high school, but I would even argue as early age, like school age, right? They come home and they're talking about their friends and they're talking about what they did at school. Their friends are so important to them. So when you're hospitalized, you don't have that opportunity to engage. You do. If you go inside the playroom, there are other kids, but like on the bone marrow transplant unit that I work on, children are not allowed to come out of their rooms at all because they're immune compromised. You have children in the PICU, the pediatric intensive care unit that may not be able to come out. You have children who may be on certain isolations where they can't come out of their room. So not only do they lose the interaction with their peers, but also other people, being able to like just go outside and get fresh air and just see children run around and playing, even if it's that, they're really losing that opportunity. Third, the impact of school and social routines are interrupted. So routines are important for all for most children, especially school age children, I will even argue all. So being hospitalized or even frequently hospitalized and getting out of that routine can really not only impact their development, but also like cause stress, anxiety, because they are used to their routine and they are wanting to be able to anticipate what's coming next. Fourth, their self-esteem, independent body image, and their body image can be negatively impacted. So depending on, like, for my population that I work with, children with cancer, a lot of times they're losing their hair because of the chemo. This can have very big impacts on their self-esteem. It can be that a child may have been like in a fire and has lost a limb, or have severe burns and now their body looks different, or in a car accident. So there are a lot of, even outside of just being hospitalized, but also now they're leaving the hospital, and what does their body now look like? And how is that going to be viewed from their friends or even from other people that may not really understand what they have been through. And then fifth, changes in their behavior may occur. Again, I know we're talking about children, but this can happen to any one of us. So being withdrawn, that can, especially when something this traumatic as being hospitalized, it can be very traumatic to a child. Not only are they being separated, and some of the impacts from not going to school or not being at home with their siblings or their family who they love, but also like all of these big things that they don't even know what's going on while they're in the hospital, that can cause anyone to have to withdraw, feel isolated. It can impact their tolerance. It can impact their them feeling lethargic, so just wanting to sleep a lot, or even having difficulty with authority figures. I would say that is more prominent in children who are experiencing chronic illness. They're over it. They're over us adults telling them what to do, and everything that we tell them what to do is more or less not right. I don't want to take my meds. Why do I have to take my meds? I don't want to get poked again. I don't want any of this. So it really, those things can be big moments for children, and it could have long-term effects on them. All right, next.
There we go.
All right, so now we're going to look at the impacts of hospitalization on children's academics.
Next slide. There we go.
Yep. All right. So first, the loss of school days resulting in poor academic achievement, right? Any one of us, even those who are not, you guys are students now, right? Losing even just one day sometimes can have a lot of impacts on your academics. So not only the loss of, even if you have, and you can anticipate what assignments are due, not being there, not being able to ask your teacher questions in person, some of those things can have impacts, and even more so for hospitalized children. Academics can substantially deviate from those of their healthy peers. So not only are it's impacting them from a sense of like them falling behind, but also now they're being measured still amongst children who are able to learn inside of a classroom setting and are able to go to school every day. There are increased odds of performing below the national minimum standard. So again, taking into account that these children aren't able to keep up with their grade level, with their peers, and the impacts that it does have on just the national standard. The loss of opportunity to learn in a traditional classroom setting, which has its own benefits. Not being in a hospital, even though we do have teachers in the hospital, it is at bedside in the hospital. It's not in like a classroom setting in the hospital. Some hospitals may have an actual classroom where children can leave and go. In my experience at CHLA, we don't have that. So a lot of their learning is at bedside, right? And at bedside, this is also where families are crying because they're stressed. Bedside is also where procedures are happening. Bedside is also where they're having to take medication and do all the things that they don't want to do. So now imagine that space that should be a protected space. Now they're having to learn in that protected space, right? Which can have its own impacts. So not being able to learn and separate the space in a traditional classroom setting can again have severe impacts to children. And then the importance of school and social routines are interrupted. Just the scheduling again of a school. We will get to it later in the slides. I did interview one of the teachers and I kind of brought in just some highlighted points. But one of the things that she stated was that her typical learning session is about 30 to 45 minutes up to an hour. It is 2 major subjects that she teaches a day. So it's not like a routine of you come in, you have your break time, you have your first period and all the other things that we see K through 12. It's just 2 hours or 1 hour a day, 2 subjects, and not much routine and not much opportunity to socialize, especially with other children their age. Next.
Ready for next slide?
Yes, please.
Sure.
All right. So needs and benefits of educational support in teachers in a hospital setting. Next, please. Thank you. So needs and benefits of educational support in teachers in the hospital setting. So they provide a quality education that supports children academic, social, emotional, and special needs while hospitalized. They help children thrive in education as they work to fulfill their academic requirements, provide guidance, support, compassion as a school community, and support mental and physical stimulation. Even though we kind of seen it with the previous quote, even though they're hospitalized, they still deserve the opportunity to learn as any other child. They still deserve the opportunity to have quality education. They have the opportunity to be met where they're at. So if you know a child is underperforming, the one benefit about having that one-on-one teacher in a hospital setting is that because if a student is underperforming, they're able to get that one-on-one support and the teachers meet them where they're at. So that is one of the most amazing things about our teachers in our hospital setting. Next, please. All right. So learning takes on very different meanings when a child is hospitalized. Going to school in the hospital can be the link to the past and the future. It reassures a child that his parents, his home, his school, and the hospital believes in getting well. And that's from our famous Emma Plank. Next. Okay, so this is where I really wanted to kind of hone in because if you guys are not familiar with teachers in a hospital setting, this was one of the interviews. I'll add some extra color. I didn't want to put too much on this slide and overwhelm anyone, but there is more insight that I can provide. First, at least in LA County, the teachers in the hospital are employed through LAUSD. They are considered Carlson's home and hospital school. So that, sorry
about that.
Oh no, it's okay. The school that is they are affiliated with is Carlson Home and Hospital School. You need a bachelor's in liberal studies or specific subject in a special education credential in order to be a teacher inside of a hospital setting. Her typical work schedule is 5 days a week from 8 a.m. to 2:30. She did inform me that she sees about 5 kids a day. It can be a little less, it can be a little more. And that she teaches all subjects, but specifically honing into math and English is like the primary subjects that she teaches. Some of the things that she highlighted with working with children in the hospital is that every day looks different. When children come to school, although they may come with high energy, they may come with low energy. They may have a good night's rest. They may have a bad night's rest. It may be family impacts and family dynamics kind of impacting a child in how they're learning or how they're experiencing, even in a classroom setting. But being in a hospital setting, a child may have had a really big procedure, may have had surgery, may have had chemo that particular day. It may not be feeling too well. And that definitely impacts the way they learn. It impacts the way they retain the information they learn. It impacts the way they interact, not just with the teacher, but with all of us. So even if a child is like not feeling too good, and sometimes she said that she just goes in and she reads books to them. Sometimes it can be listening to an audio. So there is a lot of flexibility, even though you have these subjects that you're teaching, even though you kind of come in with this goal and already pre-made schedule that you want to do. A lot of time it's really dependent on how that child is feeling that day. And there's a lot of flexibility with how you choose to teach that particular day. So there may be some days where a child is like, not feeling it today. I do not want to read this. I don't want to do this. I don't want to do that. Again, it's so important to meet them where they're at. There's moments where she'll, and I've even personally seen her do this with one of my kiddos. She'll lay plastic on the floor, get a canvas, and they're just throwing paint. And then they're writing with their finger inside of the paint, right? And they may write a sentence or they may write a really big word. So you can really get creative with the way you teach inside of a hospital, with the goal of still kind of hitting some of those big factors that you should be hitting for that day. Next, I think that is the end of my presentation. I didn't have anything too lengthy. I wanted to really open it up for questions. I just remember when I was a student and coming to different conferences and people introducing these concepts that I may not even be familiar with. I just really thrived on asking a lot of questions and really uniquely to what I was looking for. So I just wanted to get something high level. And I really, really, really want to encourage you guys to ask a lot of questions. If you are interested in going into a non-traditional setting, or if you're just want to know how it is in a hospital setting, please, please, please ask questions. I will leave the rest of the time for you guys.
So I just wanted to thank you for that very comprehensive presentation, and just a couple of comments. I think you really connected the importance of that child development, which is not just at early childhood education. And we've been doing a lot of that work in our program, in that understanding child development can serve you all the way through to secondary and beyond. And so I really appreciate you outlining that, because it's always valuable information. Secondly, with regard to your comment about the intersection of what the teacher does and how you work with the teacher, learning happens in so many different ways, and the teacher's opportunity to do that is to engage that learning and capture the sort of growth that happens there. And so as a teacher in a hospital setting, you may also have IEPs, individualized education programs, that you need to follow. So while you need to follow all of these things, you're still accountable to the student learning, but you can capture that student learning in so many ways. That example about, writing words on the floor, all students benefit from that, not just necessarily a student with an IEP or a student with a motor issue. And so if you decide that you're teaching in a classroom and you do this maybe also as part of your work or on a summer or something, you can employ all of those characteristics in many different ways. And so I just want to emphasize how wonderful you captured that. So we do have some questions in the chat, and I want to encourage all of you to feel free to put them in the chat, and also unmute. So we will start with Nikki's question. I'm very interested in working with children in hospital as a preschool teacher, and is that possible, and how would one start? And I also noticed that Marini, thank you, you put some resources in there, and that may be something that we could follow up on later on about, we've done credentialing sessions before and what that looks like. So I appreciate that information. But going back to Nikki's question, as an early childhood in preschool, in hospital settings, how would one start that process?
Yeah, so based off of my, again, I'm speaking from a child life specialist perspective. By no means am I qualified to kind of give a little bit more direction on how to become a teacher inside of the hospital setting, outside of the information that was given to me by one receiving a bachelor's in a liberal studies or a specific subject, and then getting that extra credential as a special ed teacher. I'm not sure if we have like a specific age group that you can work with in the hospital. Ideally, the way it works is that we have a certain amount of teachers, and then depending on how long a child will be hospitalized, our social work is heavily involved with getting them enrolled in the particular school that we work with, which is the Carlson Home School Hospital. That's the name of it. Once they're enrolled, it's based off of if your school age and in how long you're going to be hospitalized for. That is typically what it looks like. I'm not sure if you can choose a specific, like a preschool. You're going to be teaching K all the way through 12th grade in a hospital. I hope that answers your question. Yeah.
So Nikki, just also on top of that, you know, an early childhood background is going to serve you in any area. And if for some reason there's a higher need for early childhood at a hospital setting, and you're at a large hospital, then you might be able to work with that hospital and see what's going on and the needs at that hospital. However, as Ms. Sanford said, I would, you know, just start to do your research, but the path you're on right now as a community college student is also a great way to set the stage for you in moving into this information and navigating that sort of landscape as you get started. So just, you know, continue to look into that and how it might relate to working in that specific area. I know, like at UCLA, because UCLA and children's is fairly large too, but UCLA is huge. And I remember they actually had a early childhood preschool team for any child below 3. And then my son got transferred to another child life specialist and education specialist when he hit school age. So it can happen. And I think that the field is growing and changing in many ways. Ms. Sanford, you could probably speak to that. I'm going to go to the next question. How does someone sign up to work on something like this or volunteer during the summer? Which I think is a great question in terms of really understanding what it's like, because, you know, you think you never know what it's like until you're really in there. And even if you're not sure, it's always great to get that experience.
Yeah, so you can just go to any children's hospital that you are interested in, their website, and go to their volunteer services. Typically what happens is they'll ask you your point of interest, and then they will closely align your point of interest to what is available. I do know we do partner, CHLA specifically does partner with college students in the summer for summer programs in specific fields that you want to be. So you can do it if you're interested in like PT, OT, being a doctor, being a nurse. So if you're interested in CHLA specifically, I would definitely encourage you to go to the website in their volunteer or college program and kind of gather more information and get their contact person on the website, and even save them as a contact to be able to ask further questions regards to this, but definitely just at least find it on the website, and then specifically tell them that you're interested in teaching, and then hopefully they can get you connected with that particular department.
Wonderful. Thank you so much for that information. Yes, we have several large hospitals in our area. We have UCLA, we have Children's Hospital, even some of the larger hospitals have children's departments. So I think it's Loma Linda, City of Hope. So for those of you that are down that way, there are so many that you could examine and look into. So thanks for that. We have a question around a major. Somebody is considering majoring in sociology. Oh wait, I'm sorry, I read it wrong. If I'm in sociology, what major would I choose in a university? And so I'm wondering, Ms. Lara, Mr. Lara, or whoever you are, I'm not really sure. If you could give a little more detail on that, are you looking to major to get a teaching credential when you go to university or in the hospital child life settings department? But I guess in a general sense, what would be some useful majors as the students explore those specific areas?
Yeah, I think that the specific major will be very consistent with what you'll do to be even in a traditional classroom setting. I don't think that there's anything unique necessarily, or any other than having that special education credential. The same track that you'll do to be a traditional teacher will be the same one that you'll do to be a teacher in the hospital. You can then apply to do hospital or home aid. And in that sense, you can choose, because it's very similar to even being a homeschool teacher or like a private teacher, things like that. So I think whatever track that you're already on should be sufficient outside of just getting that extra special education credential.
Thanks for bringing that up. I see, Sylvia, you added to it, or somebody added. Oh no, that's a different person. Sorry. It's been a long day. We've been doing this since 8:30. I see you said something around single subject. Can you teach? If you have some time, I would encourage any of you, as sort of a supplement to this, we ran 2 credentialing sessions on how you get your credential, both general ed, single subject, and special ed, through our teacher mentoring network sessions, and they are also available in our archives. And so that's going to give you an idea of what that means to get a teaching credential. And if you're interested in this, I know it sounds like a lot, but as I think Steve said at our keynote, chipping away at it and doing it a little bit at a time, having that vision is how you get there. You can get that dual credential. You can get that single subject credential with the ed specialist, special ed credential. You can get that multiple subject elementary credential and that ed specialist credential. And that really opens doors. And the universities that we are working with, we are trying to streamline that process as part of our CPTP work. So keep in contact with us and with the schools that you're affiliated with, as well as Ms. Sanford and the information that Ms. Smith put in the chat. These are all great ways to start your journey, because that's going to get you to that goal, whatever that goal is going to be. Sylvia also asked, what are the age ranges? Could you tell us, what is the youngest, and then, where does it age out? That was one of my questions. For a student on an IEP, if they have a level of disability, they can go to 22, but not all students, would be eligible for that. So what are those age ranges?
Yeah, it is very consistent to what you're referencing. It is, as long as they are, and I did add my email in the chat for you guys, if you did have any further questions, but very similar to how it will be in a traditional. If they are school age, even if, like you said, they are on an IEP, and we still have them, because we still have children who, or not children, young adults who are even 22 still being seen or being followed by a children's hospital. So as long as you're still enrolled in a school, or again, receiving an IEP, then that will be the age range. There's no specific age, like you don't turn 18 and then graduate outright. Like, as long as you need the support, it's going to be there. Social work is more involved with determining who is eligible or not. That is a bit outside of my purview. But again, as long as you are eligible to be enrolled in a typical school, rather because special services, then it will be the same criteria for inside of the hospital.
Thank you so much. That's really helpful. I know we've got a little bit of time left, and my colleague's actually going to jump in because I have to open the next session. So if I leave, I want to thank you personally, but don't leave group, because there's more to come. We still have a few more minutes left. Marini, I don't want to put you on the spot, but would you be willing to just share a little bit about your personal experience? It seems, you're here, you're definitely providing some wonderful resources. Could you share with us your perspective from the parent side? I think that would be.
Absolutely. Thank you so much. So similar to what I gathered from what you were saying, Ruth, I also have a son who is medically fragile. He has a complex medical history. And I actually, he was hospitalized maybe 6 years ago at Children's Hospital, and it's actually, or I'm sorry, it was at Kaiser at that time. And that was how I met Misty Lindquist, who is the presenter for 6 o'clock. She was my son's child life specialist. And honestly, even though I'm a child development professor, I didn't really know much about the career of a child life specialist. I knew that they existed, but it wasn't until we were on the receiving end of having someone come into your child's room, because obviously when your child is hospitalized, it's very stressful. You don't know how long they're going to be there in many cases. And so having a child life specialist come into the hospital was very eye-opening, was very comforting. I think DeJuanet mentioned that they come into the room initially and they do an assessment. So basically they were determining, what are some of the things that my son needed to make him feel comfortable. And again, I'm speaking of it more from a specialist position too, as DeJuanet was, because my son wasn't getting academic support. It was from the child life side. So it was, what are some toys that are going to help him feel engaged and comfortable? What are some other things, books and different things? And then just kind of talking about his condition and what sort of treatment. And it's really like kind of having a therapist, a support system, a social worker, kind of all rolled into one. And so for me, that was really, really huge to be able to see from the recipient side how very integral having a child life specialist is to that already very stressful time when you have a child in the hospital. So for me, it's really, really vital. And it's really exciting to see over the last couple of years when we've had child life specialists, Misty's come before, talk about this and how excited students are about this career choice. And I think that that's so inspiring, because it takes such a unique person to be able to do this work, because it can be very difficult and challenging and emotional and all of those things when you're dealing with, children who are terminal, children who have very severe medical issues. And so kind of being that beacon of hope, or just that shoulder to lean on, that solace, it's a really, really unique and very special. I feel like they should have wings. They should have angel wings, because they're really, really special people. So that's kind of my experience. And as I put in the chat, I know DeJuanet had mentioned Carlson Home Hospital. My son has been a student in Carlson Home Hospital. And that is, they coin it as something that's very temporary, because the goal is to get the child to be able to go to school. But in situations where they're not able to, it's good to have an option where the teacher can come into the home for about 5 hours a week. In our case, it was during COVID, so it was virtual. And I had put in the chat that our Carlson teacher, it was something that she did after her regular day job working in special ed. So it was additional, additional money that she was earning working with my son after school hours. So that's another thing that, students here who might be interested can consider, that you can have a teaching job, and then additionally, you can support those kiddos who are not able to physically go into school. So yeah, it's a beautiful, beautiful career. And I really appreciate DeJuanet for sharing the background. And I love all the questions that you all are asking. It's awesome.
I want to encourage you to unmute or put more questions in the chat. And I appreciate you sharing such a personal story, Marini. I completely relate to everything you said. And as a teacher myself, being in and out of the classroom and an administrator for some time, it also, as you all who are taking this journey to become teachers and planning to become teachers, if you don't end up in a hospital setting, you now have a perspective as a classroom teacher that is going to set parents' minds a little bit at ease. You know that there are wonderful people at the hospital settings, when and if, or, the unthinkable could happen, and one of your students ends up in a hospital setting for whatever reason. And we still, as much as we like to think it's over, COVID is still here, and we don't know that fallout from that. And so those child life specialists, as all of our frontline workers, are those angels that really kept those things rolling. And as potential teachers yourself and planning to be teachers, as you're exploring this pathway, this is such a well-rounded connection to what you may do with the community in which you teach. So the parent community, the young adult community, there's so many layers of this. We could go on forever. I do see it's 2:52. I want to leave the forum open for a couple more minutes, and ask any final thoughts, questions.